Before placing the catheter, it's important to have the following items ready and easily accessible. You will need clippers, alcohol, and either chlorhexidine or betadine for disinfectant, the appropriate size of IV catheter, PRN injection cap, 3 prepared pieces of appropriate length half-inch tape, and a syringe of fluids such as lactated ringers to flush the catheter and check for patency. Begin by shaving a 1 to 2 inch patch of hair from the entire circumference of the thoracic limb just proximal to the carpus. Before shaving, palpate the vein you intend to use to be sure it's a good spot to access the vein. Ideally, you want to set close to the carpus so that you preserve more vein in the event of a reset being required. However, don't challenge yourself to set so close to the carpus that you cause yourself to fail or set a fragile catheter. After shaving, disinfect the area using either a combination of chlorhexidine and alcohol or betadine and alcohol. If you use the chlorhexidine, let the solution remain in contact with the site for 5 minutes, then wipe with alcohol and let dry. If you choose the betadine, swab area using a betadine-soaked cotton applicator followed by a swab with alcohol, and repeat this 3 times. After you have disinfected the area, avoid touching the intended site of catheterization. Now that the site is clipped and disinfected, you're ready to place the catheter. Ask your handler to apply pressure to the cephalic vein just distal to the elbow and allow a few seconds for pressure to build. Also, be sure that the beveled side of the needle is facing towards you and away from the skin of the patient. The angle of insertion is important. As demonstrated, try to enter the skin over the vein at a 10 to 30 degree angle. You can palpate proximal and distal to the intended point of insertion, but avoid contaminating the insertion site. Now insert the entire catheter assembly into the skin of the patient directly over the vein until you see a flash of blood in the hub of the needle. Once you are confident that you are inside the vein, advance the entire assembly a few millimeters further, but avoid going all the way through the vein. Now use your non-dominant hand to grasp the stylet portion of the catheter assembly while maintaining control of the patient's leg. Use your dominant hand to smoothly advance the catheter into the patient's vein. Switch your grip from the stylet to the catheter with your non-dominant hand and remove the stylet. Ask your assistant to remove pressure from the vein and put pressure immediately proximal to the catheter. Now place the PRN cap on the end of the catheter. This is the point at which you are most likely to displace the catheter if the patient moves or if the catheter is disturbed, so you will want to move quickly but carefully as you begin to secure the catheter in place. While taping, try not to touch the injection cap, and if it is contaminated, be sure to wipe off with isopropyl alcohol. The first piece of tape is very important since this is the only piece directly attached to the catheter hub and the patient. Turn the tape over as demonstrated and slide it under the catheter hub with the sticky side facing up. Fold the tape over to create a tab of tape stuck around the catheter hub and then wrap around the leg of the patient. Your second piece of tape should be placed underneath the catheter and wrapped around the patient's leg and hub of the catheter as demonstrated. Your final piece of tape is used proximal to the other pieces of tape and adds additional security. Be sure not to wrap any of the tape too tightly or the catheter will not be patent. The final piece of tape is particularly prone to occlude the catheter if wrapped too tightly. The catheter is now secured and you can flush using the prepared syringe of appropriate IV fluids. This will clear any potentially clotting blood from the catheter and allow you to check the patency of the catheter.